Have you ever opened your mouth wide and looked in the mirror and saw like a big silver glint in the back of your mouth? And did you ever go to see your dentist and then they ask you, do you want like a silver filling or a white filling? How do you choose? I am here to help you choose which one is better for you. Before I keep going, make sure you put code 9292 to get a free consultation in our office, Don Blanche Dental in Princeton, New Jersey. And before I continue, make sure if you like this episode to subscribe, like and share, and make sure you write in the comments here if you like the episode or if you want me to talk about a specific subject. My name is Dr. Radwa Saad. I am your host today, and I am gonna explain to you exactly what is a silver filling compared to a white filling and how you can choose what's better for you. So let's talk about the silver filling or the amalgam filling, or basically the black filling in the mouth. What is it? So this was basically invented around 150 years ago by the barber. You know, back then they used to do some dentistry work, pull some teeth, fix some teeth, and they came to that invention of an alloy, which is a bunch of metals like silver, tin, and then they started to see, okay, how can we put that into the hole? How can we do that? So they said, oh, mercury is the best thing. So 50% of mercury is part of that silver filling. 50%, 50. That's a lot, because mercury alone is pretty toxic now that we know that. So basically here we go. Powder or I used silver fillings many years ago. You know, I've been doing dentistry for over 20 years, so I've done it all. So basically they used to bring us powder or even little tablets, and the tablet is made of silver, zinc, tin, and copper. And in order to mix it, so we used to have a tiny little hammer, and we used to kind of break it down and mix it with we had a little tiny, like a dropper, and we used to put, let's put like 1 drop of mercury, and then you mix them together, and then they become something like almost like a paste feeling. And we used to take it with the amalgam holder, and we used to put it in the tooth and start to pack it in the tooth by increments, little by little, and then you go and you kind of shape it. And this is to make it more malleable. Is that good? I mean, yeah. Now let's talk about the pros and cons of silver filling. But I did that, I used that, I even used the gold foil. I'm not as old as the pharaohs, but they used it to treat their teeth. But I was trained to use it as well, like gold foil and all the fun stuff. So pros, what are the pros of a silver filling? 150 years ago, and we are still using it. I am not using it in my office, but a lot of other dentists are still using it. And why is that? Because of longevity, because it's more durable. I have patients who come to me, it's like, that filling has been in my mouth for over 20 years. Okay, but your tooth doesn't look the same. It looks a little bit different, and I will go over this in a little bit. But basically, longevity was a big thing, and of course it's cheaper. It was the cheap alternative back then, and it's still cheaper now compared to other newer alternatives. And why is that? Because it's been there for the longest time. It's much cheaper to use it for us as dentists, actually, to get to buy from a dental supplier, to buy silver filling like the amalgam, and to have a little amalgamator. It's much cheaper than buying the composite or the white filling material. And it's much easier to use it if you are really well trained to do it, especially in areas where you have a lot of saliva, like patients who are the back teeth. But that was back then. Right now there is a lot of stronger material like white fillings or even ceramic. But in the back, okay, patient has saliva, let's do this. So because it's much forgiving. So silver fillings or the amalgam filling is much forgiving to be used in areas where you have saliva or even bleeding from the gums, rather than compared to white fillings. So I want you now to start understand what I'm talking about. And back then they said it's bacteriostatic. It has mercury. So of course it's gonna kill anything. Then let's go back and talk about cons. What's going on? aesthetically, who really wants a silver filling or a black filling because it starts to corrode now? A black filling in your mouth. That's one. Two, which is really the most important thing in my practice as a dentist for over 20 years, it creates cracks and fractures of the teeth. The filling itself does not crack, but I always tell the patient, your mouth, your tooth is connected to the bone by a little ligament. That ligament acts like a cushion. So you're chewing, you're putting forces on your tooth, and the tooth basically start to move. Now, for people who are watching me on YouTube and people who are listening to me on the podcast, I'm actually trying to show how that looks like. But we are all over Spotify, Apple Podcasts. We also have the channel is also on YouTube as the Wonder Tooth Podcast, so you can watch there as well. But basically, so the tooth is surrounded by a little cushion, which is the periodontal ligament, and that ligament holds that tooth into the bone. Now, if bacteria gets in there, this is when we start to get gum disease. Now, that ligament basically helps you to act, when you're putting excessive forces on your tooth, it gives in a little bit. So imagine now you have a silver filling, which is an alloy, and it's a hardened alloy. It's not soft anymore. It's a hardened alloy, and you keep functioning. You're eating, you're drinking, you're grinding, you're clenching. And then what happens, you start to see very thin micro cracks all around the filling. So if you are watching me now, go check, or listening to me, check yourself in the mirror and look at your silver filling and start to see if there is any cracks starting to happen there. And that happens almost always in silver fillings, always. So what happens after that, you come to me and it's like, my tooth, I was eating a sandwich, my tooth broke. I was eating an ice cream, my tooth broke. Well, it's not really the ice cream or the sandwich. It's been breaking like for the longest time. This has been going on for like years now. And now it's like, okay, the tooth is like, I'm done. I am out of here. You gotta fix me now. So very important that you guys understand that those silver fillings, they don't give, okay? Now, so aesthetic, and now we're talking about, basically the cracks and fractures, but also they corrode. This is an alloy made of metals and mercury, so they start to corrode. They start to become, they're not shiny anymore. They start to become black. And not only that, but they start to creep. And what does that mean? So if that's the tooth, you have a top, like you have a filling on the top, you can, if it's an older filling and it's not polished, you can start to feel like almost a little ledge between the filling and the tooth. Look at yourself, or even put your tongue and you can feel like a little something there. Now, if you had a filling that's on the biting surface but also goes in between the two teeth and it's been there for a long time, the filling starts to creep. It starts to lose shape. And now you're flossing and it's like, why the floss is getting stuck? Why am I getting food stuck? Do I have a cavity? No, it starts to create an overhang, which is pretty awful. Overhang is pretty awful because it collects now plaque bacteria, and they're sitting there and it's like, okay, this is a really perfect spot for us. You cannot floss because every time you put the floss in, it starts to shred, and it's like, this is crazy. So the bone starts to, I don't like what's going on up there. So the bone starts to shrink away. Then cavities start to happen underneath the filling, and then you come to the dentist and it's already too late because we have a problem now. And this is when I start to tell patients we have to take x-rays, especially the bite wings. Smaller x-rays, it's not showing the whole roots, but it shows basically top and bottom teeth together. And these are the most efficient ones to show if there is like a creep or not. And if I show this to the patient and I'll be like, do you see this? Yes. Now we need to replace it, but it's not bothering me. You need to replace it because I'm trying to prevent something else from happening down the line. Okay, so now we spoke about aesthetics, we spoke about fractures and cracks, and we basically they corrode. And now, so this is a big environmentally risky thing. Back then, 100 years ago, I mean, yeah, they didn't really know that was the best thing they did. But now with the whole mercury situation, everybody's trying to stay healthy. And I do understand, and I do know that the American Dental Association and the FDA, they said it's pretty safe. But this is now What about in 10, 20 years from now, when they start to get more research done and basically they say, okay, now we realize it's not good enough. So this is something that you guys, you who have like silver fillings in your mouth, you need to understand that. Now, something very important that as a dentist, we know that, but as a patient, you don't know that. We were always taught back in school, extension for prevention. And what does that mean? So that silver filling, in order for me as a dentist to put it in your mouth, I have to shape the tooth, or basically I'm shaving now the tooth in a specific way. So the tooth basically has to be shaved like this, so that, and if you're listening, I'm doing this now on YouTube. So basically you can start to pack those little chunks of amalgam in your mouth. And we had to extend. This is G.V. Black, the father of restorative. Like basically G.V. Black was the father of amalgam. And this is how I was taught. You have to make the tooth, get rid of all those fissures, all those little grooves in your tooth, get rid of them so that you can create this extension for prevention. And this is basically to make the filling thick enough so it doesn't crack. When you do that, now you're making that filling like big. We used to say 1/3 of the tooth, basically, sometimes it even gets bigger. But when you're doing this, you're removing good natural tooth structure. And now the tooth itself, the poor tooth, is getting weaker and weaker. Now, did we solve that problem with white fillings? I'm gonna go over this in a minute. Now, the most important thing when we are placing silver fillings, it's the mercury vapors. So when we are putting a fresh amalgam filling in your mouth, there are mercury vapors. Even if we put it in the amalgamator and we have little like a little gun and we put the material in and we are condensing, when we start to condense this in your mouth, there are mercury vapors going on, and you are basically aspirating, like you're getting that. Even us as dentists too, we're getting that. And then what happens after that? So a lot of brain fogging actually has been linked to that. A lot of migraines, a lot of headaches, a lot of people that have been complaining about, stomach issues. So, I mean, if you have all these issues and you don't know what's going on, maybe you should go to see your dentist and be like, I want you to replace all my silver fillings. It's not that difficult. It can be done, and it's not like, it can be done. Just, this is food for thought. This is what I really want you guys to start thinking about. Because sometimes you go and you go get your medical, your blood work, and it's like, I don't know what's going on, but something is not, I don't feel right. I'm getting brain fogs. And so with this, everything going on, I decided like 15 years ago, I said, I will never place a silver filling again. Why? Because now we have the white fillings and the ceramic, and I'm gonna explain to you. So what is a white filling? It's a composite resin filling. Back then, long ago, because I'm not that old, but back then we used to basically cure them together, chemically cured, not even like it was, we used to put like a base and catalyst together and mix them and put them, and they used to be basically radiolucent, which means that's the really old stuff. So you take an x-ray and you see like a black thing, and that's usually when you have a cavity. But the older type of composite filling, they used to look like that, radiolucent. The problem was if there was really decay starting to happen underneath, you cannot see them. But then the dentistry started to revolution, and basically, okay, researchers done their work, and now we have composite filling that are radiopaque. So when we take a little x-ray, we see a white filling, and we understand now, we see white on the x-ray. So if there is decay underneath it all around, we start to see like a little black line. Okay, now do you understand the difference? But that was mostly aesthetic, in the aesthetic zone, like the front tooth, bottom, when you're smiling. But in the back, they used to put the silver filling still. Then because the material was not strong enough, then they were able to actually fabricate, or basically manufacture white fillings, composite resin, that are very strong and can withstand pressure and basically the chewing forces, especially in the molars in the back. That's what we are using now. So you have now a white filling that's pretty strong, and it can show on the x-ray, it doesn't get better than this. So the pros now of like a white filling compared to this: aesthetic, definitely; strength, absolutely. Now, remember when I said when you eat with your, if you have silver fillings and then you start to see micro cracks? Yes. Does the white filling do that? Well, they have some flexibility, so they do actually flex with the tooth as well. So this is a very big plus, okay? And even better, like there is no mercury. There is no mercury in your mouth. And the big one that I didn't even mention, they are not temperature sensitive. If you have a very big silver filling in your mouth that's been sitting there and you eat or drink, you get some sensitivity. If you even have a silver filling on the top and a silver filling on the bottom and you're chewing, you might sometimes get like almost like a metallic shock, like an electric shock. And why? Because it's metal against metal. Did any of you notice that, or basically had that? If you did, write in the comments below here, let me know what's going on if you actually had that. So start monitoring yourself. But with white fillings, if you have white fillings against white fillings, you'll never have that. Okay? Now, let's talk about the cons. Of course, it's much more expensive than a silver filling. Why? Because that's dental suppliers. That's not even us, guys. It's a dental supplier. Okay, composite resin, it takes, more to get it done and to fabricate it and this. So it's more expensive. And two, a lot of the dental insurance, they don't even cover it. They say alternate benefits. What does that mean? And a lot of patients are like, why do I have to pay for this? My insurance covers everything. They cover it for a silver filling. And why? Because they're cheap. They're very cheap. You are paying all your deductible, but that's what's in your plan, and that's what they don't want to pay for it. So here you go, you're coming now, and it's like you're trying to fight over whatever the difference is. But this is really much better for you. You might want to talk to your insurance or change the plan. Anyway, but you have to do what's better for your health, right? And what else? It's technique sensitive. So remember when I said a silver filling, you can use it in an area where you have moisture or saliva or blood. White fillings, you cannot. So we have to keep the area extremely dry. And this is when we have like big suctions and small suction, and we're like going like, okay, keep your mouth, put a little block in your mouth to keep things open, put like cotton rolls, kind of keep it really, really dry. Then also it can stain a little bit over time. So let's say you have a filling now for 5 years, you can start to see like a little almost blackish line around. And why is that? Because it shrinks. When you drink or you eat or whatever, it shrinks with something hot. It's composite resin and it can expand. So when that starts to happen, you can start to get little staining on the margins, but also you can start to get recurrent decay. And that's why a composite filling is not as durable or not as doesn't stay in your mouth for as long as a silver filling. Okay, so a silver filling probably 15 years. A white filling, probably 5 to 7 years. We always say around that. Okay, if you're maintaining things, of course, very, clean. And the big thing, in my opinion, as a dentist, really between a silver filling and a white filling is we're not cutting the tooth as much in case of a white filling. We are very conservative. So let's say you have a little dot of a cavity right here in that part of the tooth. We just go in and we basically clean it up, and that part, like the tooth, basically the filling bonds to it. The composite filling, it bonds to the tooth. In the case of a silver filling, we have to do mechanical retention, not chemical retention. So what that means, we have to cut the tooth in a specific way so that we can pack the silver filling, the amalgam basically inside here, so it kind of stays and it's just holding itself properly. Okay, now let's talk about a little bit of ceramic as well. I mean, they're not really fillings, white fillings, they are ceramic, which is the best, which is basically inlays, onlays, and these are indirectly made. What is that? So if let's say you have a big cavity and the composite filling alone is not strong enough to withstand the pressure or the fracture, so like it can fracture. So what do? We can basically shape your tooth in a specific way, scan, And then we can fabricate a ceramic restoration, like made of porcelain, that we can go and glue it in, and that's pretty sealed, done, customized, done, and it seals everything and is pretty strong because it's ceramic now, it's porcelain, it's not even composite. That can last actually much longer. So if you compare this to a silver filling, ceramic, they actually last for much longer than even a silver filling, and they're not as harsh. There is definitely no mercury in it. They look very aesthetic, very pretty, and there is no also temperature sensitivity. It's ceramic and there is like, it's sealed, beautiful. Okay, now the most dangerous time when you start to get mercury vapors in your mouth, 2 times. When we are putting the silver in your mouth, like basically the amalgam filling is being packed in your mouth, mercury vapors, or if it's being removed, mercury vapor. So what do? We have to use, as dentists, we have to use very high suction. Sometimes we have to put a rubber dam. What is that? You know, that's the rubber thing that we put when we are doing a root canal, because we just don't want anything to be ingested or vapors to be around. Okay, I hope that kind of cleared a little bit, you know, the big fight. Okay, should I get a silver filling? Should I get a white filling? If I were you, I told you today pretty much how to choose between a silver filling and a white filling, the pros and cons, and what possibly can start to happen to you, to your health, you know, from this versus that. Okay, if you are facing, you know, or if you are feeling any of those symptoms I was talking about, please write in the notes below here. Let me know what are you experiencing, and I am here if you need any consultation or if you have any questions. Okay, and my office is in Princeton. We don't forget to put the code so that you can get a free consultation as well. All right, don't forget to take care of your teeth so that they can take care of you and make the right decisions, and keep smiling with Dr. Saad. Have a good one, everybody.